Hi, my name is Gianna Boveri, and I'm a master's student at University of Florida, and I'm studying health education and behavior. Here's my presentation on my philosophy of health education and promotion. So, the core of both health education and promotion is prevention. Prevention education has shown that it empowers individuals to take charge of their personal health and well being. Preventative health practices can vary. Some examples are community education events, improving community health literacy, access to healthcare supplies, and policies that promote well being, amongst many other things. The items mentioned allow for communities to be better equipped on micro and macro levels to both prevent negative health outcomes and contain the capacity to handle incidents when they arrive. In a senior year clinical psychology course within my undergraduate program, I had a realization. Rather than solely focusing on mitigating the consequences of adverse health behaviors, I felt compelled to shift toward prevention. This decision marked the commencement of my professional path in health promotion. Within my experiences of my early career in college health promotion, I recognized three foundational principles that are crucial to the field. Those being advocating for harm reduction strategies, fostering empathy and resilience, and upholding a nonpartisan position. Here's my personal philosophy statement for health education and promotion. My philosophy focuses on harm reduction, empathy, and evidence based practices. I aim to minimize risks, foster understanding, and advocate for unbiased approaches to improve community well being. Experiences with diverse populations have greatly influenced my commitment to empowering individuals to make informed decisions. So, one of my three main tenets of my philosophy is empathy and resilience. So, one of the first pieces of this is what I like to call becoming the rock to be the rock. And I talk a lot about this doing college health promotion and talking to my colleagues. So, practicing self care to build resiliency, preparing our minds and bodies to be the person who can handle difficult situations and touchy subjects. We're very prone to compassion fatigue in this field, so it's important to be aware of burnout and learn to recognize our personal signs of it. Next is rapport building. Rapport building is extremely important, especially in a field like health promotion where we often speak to individuals about stigmatized and or taboo topics. In my experience, individuals will feel more comfortable coming to you with questions as well as have more respect for your word once you've built rapport with them. The last piece of empathy and resilience is what I call difficult responsibility. There are many difficult responsibilities associated with working in health promotion, specifically college health promotion in my case. There can often be very heavy and triggering situations at hand, such as dealing with students who may um, have allegations against sexual assault or students who are having severe substance use issues, things of that nature. But we must prepare ourselves to be the ones who can take care of such matters and come out clean on the other side so that we can do it for the next student who needs our help. Okay, the second important tenet of my philosophy is nonpartisanship. When I say nonpartisanship, I mean that in health promotion and public health, our one shared goal is health and promoting well being. These initiatives can be disrupted by things like political aims or hidden motives. So, individuals working in our field have one thing in common, and it's to improve what I've mentioned before. Being tied to these things can impede progress and make things take a lot longer to get completed, such as interventions in cities like Narcan teams, things like that. I heed the wording of Dr. Leanna Wen. Quote, public health professionals should be aware of the politics involved in formulating policy, but the recommendations from public health can never be perceived as having partisan aims. Her departure from her position at Planned Parenthood is a great example of commitment to political neutrality in public health. Dr. Wen's mission was to provide accessible health care to all, and the specific political beliefs of the Planned Parenthood organization would prevent this goal from coming to fruition. A good example of nonpartisanship in health education would be advocating for comprehensive sex education in a school district that advocates for abstinence only education. This exemplifies nonpartisanship because the goal is health, and we need to provide the future generation the information they need to make safe health decisions. Here's the final and third tenet of my philosophy. I would say that this is probably the most important one. So, Samsha defines harm reduction as the practical and transformative approach that incorporates community driven public health strategies, including prevention, risk reduction, and health promotion, to empower people who use drugs and their families with the choice to live healthy, self directed, and purpose filled lives. I like this definition, but I definitely think that it's a little inclusive to drug use, or rather exclusive to other things. We can use harm reduction when speaking about things like eating disorders, binge eating disorders, for example. Maybe not keeping the binge eating foods in the house to create a safer environment for that individual is a good example of that. Harm reduction in health education and promotion refers to an approach that aims to minimize the negative consequences associated with risky behaviors rather than focusing solely on eliminating those behaviors. This is an extremely important component of my philosophy as it shapes many of the things that I do. For example, I will never tell students not to do something, such as go to the bar on Friday and get severely intoxicated, but I will teach them how to reduce any risk or harm associated with any opportunities they may encounter while out in the wild. Harm reduction programs or initiatives may include things like needle exchange programs, supervised consumption sites, safe injection sites, opioid substitution therapy, and distribution of naloxone kits to reverse opioid overdoses. Currently, I provide Narcan trainings with kits that contain supplies like face masks with bite blocks for CPR and drug testing strips for xylazine and fentanyl, which are all great forms of harm reduction. By incorporating harm reduction principles, such as meeting individuals where they are, providing non judgmental support, and focusing on reducing immediate risks rather than abstinence, health outcomes can be improved by reducing transmission of things like bloodborne infections, preventing overdose deaths, and engaging marginalized populations in healthcare services. The effectiveness and benefits of harm reduction strategies include lower rates of disease transmission, decreased substance use related injuries and deaths, improved access to healthcare services, increased trust between individuals, like rapport, like I was saying earlier, and service providers, and overall better health outcomes for these communities. So, by prioritizing harm reduction, health educators can build rapport with individuals, empower them to make healthier choices, and ultimately contribute to the overall well being of populations. So, now I want to talk about the influence on beliefs and career trajectory that my philosophy has had. So, my personal philosophy shapes my approach to supporting individuals and making informed decisions by emphasizing harm reduction, empathy, resilience, and nonpartisanship. So, by embracing these values, I aim to drive positive health outcomes by adapting to an individual's unique circumstances, providing non judgmental support, and promoting evidence based strategies to reduce harm. Um, I do these things because of personal experience. My personal experience is that I'm in addiction recovery for alcohol myself, and I've lost loved ones and I've observed it. So I do the work now in the population that I once was when I had an addiction. And harm reduction seemed to be the best route for me and a lot of the people I know with addictions. Um, my professional experience with this is now that I've gotten sober and I can work and teach others and hold recovery groups. I found that harm reduction is a very effective strategy, not only to reduce risk, but even these students have shown that they're more likely to um, enter recovery rather than just being recovery curious. Um, my family and friends, as I mentioned before, they've impacted my life, and being around other people in recovery tends to promote the success of recovery. So that is who I'm around at this point. But um, family who have passed away from addictions and didn't have the resources have truly impacted the work that I do. My personal philosophy shapes my approach to supporting individuals and making informed decisions by emphasizing the three core tenets I've been detailing. By embracing these values, I aim to drive positive health outcomes by adapting to an individual's unique circumstances, providing non judgmental support, and promoting evidence based strategies to reduce harm. Lastly, I'd like to discuss influences of beliefs as a future health education specialist. So, one, advocacy for inclusive and evidence based health education practices to contribute to community and well being. Two, fostering of supportive and empowering environments for individuals to thrive and make informed choices about their health. And three, promoting equity within health education and promotion systems. The impacts on my career trajectory and personal beliefs summarize my philosophy in a nutshell. If my philosophy could speak, it would say endorse embracing harm reduction, empathy, resilience, and nonpartisanship to enhance positive health results. I am a firm supporter of inclusive and evidence based health education methods customized to meet individual specific requirements, engaging with them at their level. This strategy is designed to assist individuals in making informed choices, promoting empowerment, and enhancing community welfare. I prioritize a comprehensive approach to health promotion that emphasizes individual autonomy and self determination. And here are my references. Thanks for watching.